You know, it's been a tough 19 months on the world. It's been a tough 19 months in every single age category, from a newborn being born into a pandemic to an elderly person that hasn't had the opportunity to visit with anybody, who's been isolated, to students who have had their whole educational life being turned upside down, to those of us in healthcare who continue to live our oath despite the stresses and despite what goes on. So we're going to talk a little bit about that today. But today's also a day to really, you know, heal, to ask questions, to talk about your own stories regarding the pandemic and get my perspective on them. This is actually a very difficult talk for me to do. I would have much rather have talked 3 years ago. We could have talked about my passion for health and wellness. We could talk about my passion for leadership and for living the Hippocratic Oath, not 19 months of trauma that I'm still undergoing. And so this is the only second time that I've actually spoken about leading through the pandemic. And so it could get a little tough on me today. You all help me and laugh at my jokes. That's the most important thing you can do today, because laughter is medicine. And it's interesting because one of your colleagues today pointed out that I put plasticity in my topic because I couldn't really use the voice of Ross yelling pivot on a slide. So the technical term I used was plasticity. But my whole organization knows, because I actually will start titling emails pivot when we actually have to change direction and move along. So let's talk about the start. March of 2020. Prevea Health is a very unique healthcare organization. 50% of its common stock is owned by its physicians, myself included. The other 50% by our hospital partners, Hospital Sisters Health System, for those who live on this side of the state, that'd be St. Joe's and Sacred Heart up in Eau Claire and Chippewa. Only one of its kind in the country. We were having a great year. I mean, it's just probably our best year ever. Everything was clicking. Recruitment was clicking. Finances were clicking. Buildings were being built. Cutting ribbons in Menominee. I was having a good year. So I did something I rarely do. I took a vacation. I think the pandemic taught me never to vacation again. So my wife and I enjoy weekends away, because sometimes it's pretty tough for me to get away for a full week. So we went down to Miami to our favorite hotel to hang out at the pool and by the beach. And news was flooding in. You know, we knew prior to March what was going on in China. We started to see what was going on in Europe, but March was New York. It was essentially starting ground zeros around the country. And we knew that things, the way that transportation works in the world and the way that the economy works, that there was no way that this wasn't going to happen in Wisconsin in days. So instead of enjoying and working on my natural tan, I read like crazy on the beach to understand and connected with colleagues across the world. Because not only am I a CEO, but I'm also a practicing physician. So I needed to learn for two different reasons right there. Got home, and you know, my poor team over the weekend was getting messages like flurry that I wanted this meeting on Monday morning when I land. I want X, Y, and Z. I want this team to get together, that team to get together, and we need to start planning. And we needed to pull the community together too. And we'll talk a little bit about pulling the community together. And it's no different. You know, we were kind of clueless, to be honest with you, at that point. Actually, we weren't kind of clueless, we were clueless. We were learning, as scientists do, at probably the most rapid rate that we've ever learned. And we'll talk a little bit about that. So my first lesson to talk to you guys about, within that first week, as a leader of almost 2,400 people, I had to address them. And another cool thing about today is this is not on Zoom. Bad part is I had to wear pants. But you think about it, I had to address, and at that time we're all kind of learning how, we'd actually had a Zoom contract, in full disclosure, prior to the pandemic. One of the few companies, because we were testing it out, because we turned statewide, and we suddenly had to become Zoom experts. And I had to address 2,400 people I love. Like I mentioned, why I explained our corporate structure to you is we're very unique, the only one of its kind in the country. We own the company as physicians. Our employees aren't just employees, they are our family. And you had to address 2,400 people, and I didn't have a plan, which it's not really good as a CEO when you kind of start with, I don't know what we're doing. I was scared, very scared. I was unprepared, as were most leaders. And I asked some of the people I care for the most to put themselves at risk because we didn't know. And we saw healthcare people going down in China. We saw what was going on in Italy. We were seeing some very famous pulmonologists now dead from the virus. And I'm asking my partners and my people, our people, to go into battle. Now, as a physician, we do a lot of risky things. We go into codes. We're covered in blood. We get needle pokes. We understand there's a little bit of a risk in our career. Nowhere near a risk of, say, a firefighter or a police officer or somebody in the Army, but everybody has different risks in their career. And all of a sudden, our risks are being elevated. We're not trained to tell other people or how to help other people go into battle. Essentially, that's what we were doing. I think you've seen us all gown up, put a capper or a papper on that's like the moon suit or our N95s. And it's literally like you're preparing to go into battle. We're not prepared. We're never prepared to help our teams through that. So I'm a relatively young leader. At least I still like to think so because I'm only 49. I became CEO at 36. So at that point I was a really young leader, and I still like to use that biopic because it still proves I at one point had hair and it was dark. And I had to address all these people as a young person. And that day I found out that I'm not very good at hanging up Zoom fast enough. Because at the end of my speech where I told them to be smart, we need to use the science, let's be careful, that we need to be patient with the world because news is flowing in and that we're gonna change, we're gonna pivot, we're gonna exemplify plasticity, to be kind because it's gonna get rough, and to be well, to take care of themselves. And when you tell them to be well, at that minute, knowing I just told them to also put themselves in danger, I lost it. And I couldn't hang up quick enough. So I think probably the first lesson, and nobody talks about it to this day in our organization, about that Zoom. Everybody saw it. Everybody was quiet when I walked out of my office about 20 minutes later. Nobody looked me in the eye. Everybody knew that was rough. Nobody's talked about it, but I know everybody's seen it. And it was probably the biggest lesson, for the first lesson I could ever go by in leading anybody through, whether it's a pandemic, an emergency situation, a merger, an acquisition, whatever you wind up doing in life, you will lead something. You will lead communication. And honesty and vulnerability was what I taught that day through myself, and taught myself that, but taught my organization that. So that's how we start off in March of 2020, and a few other lessons from that point on that we'll talk about. But I think still probably the most important lesson came from that first day, that it's okay to be scared. It's okay to let people know you're scared, and it's okay to talk about it finally. So like I said, it's only the second time that I've actually talked about that Zoom since I did it. I was wearing pants that day. There are some funny stories about me on Zoom that we can get into. If we run out of things to talk about, we can talk about that. So, okay, you're in the middle of a pandemic and you're a scientist, you're a pretty well-trained physician, you still practice, people listen to you, and everybody's coming to you for information. So I had to figure out the best way to educate, because as physicians, we are natural educators. It is part of our role. We tell you to quit smoking, we tell you to lose weight, stop drinking, wear a mask. I think people follow all four of those pretty equivalently. And so we had to educate. And kind of a weird sense of scheduling happenstances and different healthcare leaders, and somehow it worked out with my schedule that I was the one to do the first broadcast on this issue on WBAY, which is our ABC affiliate, and they have a morning show. It's pretty popular. And I was asked to join the morning show to help educate. And then they asked me to come back the next day and the next day. And at one point I was during the heat of the beginning of the pandemic doing it daily, then 3 days a week. And I still now do it weekly, taking a couple weeks off here so I can recover from the Ryder Cup. That's a whole other fun story. So what was supposed to be a one-time appearance turned into regular appearances on the media for 18 months straight. Now, as a physician in training, we're used to working without sleep. When you graduate, you always swear to yourself you're not going to get up at 4 o'clock in the morning again. Well, guess what I had to do TV? I had to get up at 4 o'clock in the morning again. I think what was really cool about my experience in the media, and just so you know, tons of physicians around the country got put into the same boat I did. You know, everybody, John Raymond down in Milwaukee did an amazing job as the president of MCW. Obviously, Tony Fauci, everybody looks at. If you ever watch me when I do it from my office, Harrison's Internal Medicine is sitting behind me. You know who that's written by? Fauci. So I always have him with me when I do it from my office. But thousands of physicians were doing this in communities all over the state. I did some on the west side of the state too. I think what I'm most proud of though, and one of the things that I learned the most on how to engage a community in a time of crisis, is they don't want to always be talked to. They have questions. So 50% of my broadcasts were all based on viewer questions. And for me, as a physician and not a media guy, I mean, that is just not what I was trained to do, was home. Because it's a patient asking me a question and I could address them by name. So it was an awesome experience and an awesome learning experience, not only to educate, but how to interact with your community. And it's not always about talking to them, but an active participation, which I hope we'll have today, amongst all of you. So all that being said, I think I've done over 1,000 media broadcasts, both locally, the west side of the state, statewide, nationally. I think probably one of the hilarious text messages I have is, "You made Anderson Cooper cry." He played a clip of me from WBAY and got emotional on TV. And I didn't know that because I did another CNN interview. I didn't do the one with him, but have that. And I asked my daughter one day, "Have you ever seen Dad on TV?" Because, you know, my kids and I, we have a blended family, so I wasn't always seeing them. And because of the pandemic, because of isolation, I was doing driveway visits with my kids. That's a whole other set of trauma to talk about. Do you ever see Dad on TV? "Dad, you have your own tab." I'm like, "What do you mean I have my own tab?" So this is from the WBA website. I guess I have my own tab. You can click on my name and broadcasts throughout the year are saved out there. Most of which, it's interesting, I can go back and watch. I'm like, I can't believe I said that. It's totally different now. Pivot, plasticity, change. So I guess my second lesson is, and this really comes in when I did all of that media, part of doing media, especially during a pandemic and as controversial as COVID has become, and I don't want to make this a right and left speech or that, but you also make yourself a target. Now, all those community questions came on this new med school that's out there called Facebook. And it was interesting because there's all these doctors all of a sudden that wanted to debate on Facebook, and some didn't always say the nicest of things. Like most physicians around the country that spoke up, we got threats. My wife has a panic button, and I've had security increased around the house at times. But that's okay, because I think my number one lesson in education is do the right thing, no matter what people will say about you and to you. And it's very important when it comes to resiliency and leadership is to have conviction when you educate. And to be able to do that no matter what anybody else says. They came at me and my family. They used pictures of my children, and they still do. School boards will still do that, and threats of harm. Unfortunately, nobody has the guts to say it to my face, but you know, it is what it is. But as a physician, you know, everybody asked me, "Why are you doing this?" My wife would ask me, "Why are you putting the family through this?" The only people who didn't complain were my children. They're very resilient, just so you know. When they used a picture of my son playing soccer in a regional tournament and he didn't have a mask on, despite his dad saying on TV, "You don't need a mask outdoors," they used that. And his only concern at that time, if his hair was good. I challenge you to go watch my son play soccer one day. There's an interesting stat on there. How many times in a game will he fix his hair? They did really well, but people kept asking me, "Why are you doing this to yourself?" I'm like, I'm not doing anything to myself. I'm living my oath. You know, as a physician, the day we graduate, it has nothing to do with the diploma, it has nothing to do with the commencement speaker, it has everything to do with putting your hand up and taking the Hippocratic Oath. You've worked your whole educational life for one period in time, because from that point on, you are doctor. And it's called living the oath. If you come to my office, I have a lot of cool memorabilia. My diplomas don't hang. They're by my parents' house, someplace, I think. But the oath hangs. And that's very important to me. So that was a big lesson to me. And one of the biggest lessons I can tell you is all of you at some point in your careers in education will lead, and understand that your job as a leader is to be an educator. No matter what profession you're in, you will be an educator. You will teach something to somebody, and remember that and hone those skills. And you can't stay away from that responsibility, no matter what the consequences are to you, especially when you make a promise like the oath. So let's go on. You know, we're educating like crazy and preparing. You know, being strategic in a pandemic is really interesting. As it turns out, you don't know what you're doing. But we were learning. We were learning like crazy. Med Twitter probably saved the world, believe it or not. Hashtag Med Twitter, because a lot of information was being shared. We were talking to our colleagues in Italy. We were talking in Europe. We were learning from China. And we were trying to dissect the noise, but there's never been that fast of scientific educational exchange as there has been in 19 months. I mean, we were just constantly learning. You know, does it look like ARDS? Should we prone them? Should we not prone them? What about steroids? You know, did they work? Did they not? Secondary infections. All this communication was going on rapidly through the world as we were trying to save lives, and people were dying. At one point in Brown County, where I live, we had one of the highest death rates in America because we had the meat packing plants. So people were dying, young people were dying right in front of us. So we were trying to learn as much as possible. But as a company, and one of the things I directed us to do is, I honestly felt, and I do to this day, and I actually, all of our strategic decisions, if you go back and dissect what we've done, I felt like 90% of the healthcare battle had to be fought pre-hospital. That when they got to the hospital, battle was lost. And if you look at what happens in the hospital when a patient comes there and all the long-term consequences, even if they live, the battle's essentially lost when they get to the hospital. So what can we do pre-hospital to stem this pandemic? Stop the spread, increase treatment, do what we could to mitigate what was coming into the hospital. So we stood up testing sites. You can see a picture on here. I think you can see it up there. So those are 2 construction trailers. So we build a lot of buildings at Prevea. So I have a little bit of construction experience, and more importantly, a lot of people owe me favors. So went out and got 2 construction trailers. So there are doors on the insides of these, like there would be office trailers. Those are storage trailers, and a friend of mine owns a roofing company, so there's a rubber roof on top of that. And we stood up 6 of these within a week and a half. Got electricity run to them, IT run to them, got all of that done to start testing people. Do you know what we lacked when we built those? Tests. We did not have the ability to test anybody, but we went out and built these anyway, because we knew at some point the only way you can control a viral pandemic outbreak is to test, trace, and isolate. It's a basic epidemiologic class on how to control something. You have to test, trace, and isolate. So 90% had to be fought pre-hospital. So we went out and built it. We had created screening programs to screen patients as they come in, because we weren't doing other things. We weren't seeing patients normally, but we still had people coming into the office for needed medical care, so we had to screen them. We stood up telehealth visits in 48 hours. Now, we already had a platform, we just had to expand it. The one lesson I would have is I should have bought stock in video cameras. Should have gone on Amazon at that time and tried to buy a webcam. It was pretty interesting. We stopped doing, quote, elective procedures and imaging. One of the hardest decisions I think myself and other CEOs and other healthcare leaders made across the country. And I think a lot of us regret it. I'll be very honest with you. We created this impression that what we do in the operating rooms and every day is elective. And cancers got missed. Cancer diagnoses got delayed. Cancer surgeries got delayed. They didn't get optimal therapy. People stopped coming in for their heart disease. People were dying at home. We made a bad call. We didn't educate enough about what elective meant. But we were in crisis standards of care almost, you know, where we just had to take care of what was in front of us, and we didn't want to expose somebody to something we didn't know, and we also didn't have the ability to test at that point. For those 3 to 4 weeks that we were shut down, we were trying to get a testing infrastructure to try to create a safe environment in the hospital. But this pandemic has killed more than people that have the diagnosis of COVID. And that's a great example of it. We learned treatment protocols, like I said, all over the world. We learned, we've always prone patients. I always love the look an ICU nurse gives me when I order proning. We have a really cool story about that. When we get to the end, we can talk about what we're doing now, but we went through a lot of different things to figure out how to take care of this group of patients with a virus that was extremely challenging. I always loved it when somebody would say, in a social media post, it's just like the flu. My God, I wish it was. I really do. So lesson 3, in all honesty, no solution is perfect. And in crisis, a lot of times you got to move towards the solution, even without everything in place. Building those testing sites without swabs or reagent was a huge deal. It's not like we did them for free. We worked the phones all over the world to get supplies, every corner. A friend of mine, most of you have seen commercials for the Peloton. So I'm what you might call one of those Peloton OGs. We're some of the originals. So back when it was formed, you were friends with the instructors. You went to New York and you hung out with them. And a small group of us became very close all around the country. It's kind of a cool story. So there's hundreds of us that actually, when we travel, we visit each other, all based on a bike. So one of my friends, he did a check-in visit on me because a lot of people were checking in on me and asked, how you doing? You're probably getting your butt kicked. I am. And I'm like, I just can't believe it. I can't even find masks out there. And he goes, so they own an Amazon distribution warehouse. And he goes, I have 3 pallets of medical masks sitting here. I don't know what to do with. They happen. And he goes, and they all have this N95 written on them. Needless to say, I'm like, I will send the truck. And they shipped them. And he's an awesome friend who did that for us. So it's the little things in these 19 months you just never expect, the blessings and the challenges. We actually had another person read an article locally in Green Bay about Nebraska was using UV lights to clean N95s. And there is actually, during SARS, we did the first SARS epidemic. We did some research on this about what levels of UV light it would take to clean bacteria and viruses off of an N95. So it was really well researched. But how are you going to build a UV conveyor belt in the middle of a pandemic? Till one of your friends calls, we both had kids go to school together. He owns a pet food company. And he had an extra UV conveyor belt sitting in a trailer that they used to clean chicken for pet food. So we repurposed it, and literally we built a room, probably from me to the end of the wall over there. And you would put the N95s that come in used and tagged with people's names on them. They would come out clean. There would be people from our sterile supply from the operating room, because guess what? They're not in the OR anymore, so we wanted to put them to work. They're used to sterilization. They're on the receiving end with a clean N95 delivering it. And we did it for ourselves, we did it for our competition, we did it for the dentists, we did it for the firefighters, we did it for the police, we did it for anybody who wanted to use the conveyor. And we got really creative. So remember, no solution is perfect, and sometimes you just have to, skate to the puck, I guess, as somebody once said, but in this sense, you start working on the solution without everything in place. We went searching for supplies for testing, and then I was sitting across the hall. My chief of quality, who's a good friend of mine, and vice president of quality, Dr. Pritchard, and I were talking. Our offices are across the hall, and we're just talking to each other. And I'm like, we need to figure out testing, and it's all genetic testing. Literally, that's what PCR is. It's a form of looking for a genetic material. And I go, I wonder if our Cologuard people have any solutions. That's Exact Sciences. Well, it turns out the same idea I had, the governor had, and everybody else in the state had. But we knew our salesperson. So we called our salesperson, and we were the first ones to get the Exact Science testing kits delivered to the state to start testing for COVID-19. I held the first one aside for the Wisconsin Historical Museum, because that was the turning point in the state of Wisconsin. We could finally test. And that was amazing. And I don't think people realize how lucky we are in Wisconsin that we had that capability. So we didn't wait for solutions. We created them on the fly. And we encouraged everybody to think, outside of the box. And you have to give your teams freedom to do that. And that's probably one of the more important things I did, is I gave our teams freedom to just go out and do things. I gave them freedom to go out and spend money. Now remember I said we stopped doing elective procedures. We are at this point probably 100 million in the hole at that point, and we were spending money not cutting people. One of the biggest things I think we did is we spent our way out of the pandemic instead of cut our way out of the pandemic. And it was really important for us to do that. So partnerships, we quickly realized that our industry was in crisis. Everybody else was too. And, I was hearing from our suppliers, different businesses, schools, colleges, universities, everybody was hurting. So we did regular business town halls. Some people have attended those, I found out today, to keep other leaders up to date, answer questions. Public health is awesome, but it was never designed for a pandemic. It really isn't. And so their capabilities were stretched, and as healthcare, we needed to partner better with them. So we decided that we would start coaching people through contact tracing, coaching people through questions they would have on quarantine and isolation. What do I do with X exposure or Y exposure? And why did we do that? Because 90% of the pandemic had to be fought pre-hospital. The more education we would do, the better chance we had of controlling this. So we actually went in to employers and we set up safer, working environments. We didn't charge for any of this. And we educated around cleaning and masking and how to help them set up their environments. And we became a hotline for isolation and quarantine questions. To this day, I have law enforcement. I don't know how they have my number, but I'm glad they do because it means I have a penchant for speeding. So it's really good when you take care of law enforcement. But I get questions from sheriffs and police chiefs from all around the state to this day when it comes to an exposure or a certain situation or what's going on in the jail. And for our HERC, which is basically the state is divided up into different divisions, I think there's 6, with our health emergency response coalitions. We met daily at 7 a.m. So that would be myself as a CEO and the CEOs of our competitors all met daily with public health. Every morning at 7 a.m., I led the Zoom and we went through what our numbers were in the hospitals, what we were doing for testing, what was going on with our own people and how many were out, what we were doing for crisis care. We tabletopped everything. To this day, including this morning, the CEOs of Aurora, Bellin, and myself still share our numbers every single day, except for the weekends now because we want to sleep in. It's usually at 6 a.m. I get our hospital numbers at 3 a.m. I don't look at them at 3 a.m. I look at them around 5:45, and then Tom Miller at Aurora is always the early bird. He starts the text thread at 6 a.m. But you can literally scroll this text thread back 19 months of showing what partnerships can be in a time of crisis. Business competition cannot exist in a time of crisis like a pandemic, and we proved that. Our schools were also in crisis, so we put together superintendents, and to this day, I still meet with superintendents on this side of the state and on the other side of the state every Thursday morning. For a rare exception that I take a day off, but somebody else fills in with me, and we continue to educate schools. So I guess, going back to that lesson, there is no room for competition in a time for crisis. They're just not. And I think I think we demonstrated that in our part of the state. There's absolutely no room for ego. Doesn't matter who's running the meeting, doesn't matter who has the idea, who had the idea first. When we set up and I'll show you pictures of this, when we set up our first vaccine site, which is really fast forwarding this talk, we also gave the playbook to our competition on to do the same. It's very important to understand there can never be ego in crisis, and everybody has to pitch in to help everyone else, and you have to empower people to do that. Those ideas weren't Dr. Rai's ideas. There were a great team's worth of ideas that we empowered to go out and do it. And success is only achieved as a whole. And as I mentioned, we still get together. We will not get through this pandemic with healthcare just trying to do its job. That was probably one of my biggest lessons learned right away. If I did my job great, another 200,000 people are still going to die. It's getting everybody else on the train with us has been our goal and the ultimate lesson. Hope I didn't. Just making sure I didn't skip a slide here. Nope. So now we're getting into probably the hardest month for me to talk about. Show and tell time too. So it's November of 2020. So we're approaching a 1-year anniversary of it. And it was the worst of the pandemic for us in Wisconsin. If you actually look at Wisconsin statistics, it was really bad. Guess what? It's really bad now. Our hospitalization rates are approaching that. Unlike now, where we've got treatment regimens and vaccinations, we didn't have any of that back then. So our most vulnerable are coming into the hospital. Right now, we still have vulnerable people that are unvaccinated coming into the hospital, but they're not dying at the rate of what we had last year. It's a significant difference of our hospitals being overwhelmed now than last year. The hard part is this year they're staying in the hospital a lot longer because they're living. The hard part last year, shorter hospital stays because they were dying. And it was a really tough time for us. I still practice medicine. I think that's really important. If you're going to lead a healthcare organization, you better know what you're doing, which means taking care of patients. Most of my work now has transitioned into nursing home work, but acute rehab. So basically a trauma patient leaves the hospital and needs to spend 6 weeks in a nursing home. I'm the guy who picks them up. And COVID hit the nursing homes pretty hard, as you guys know, and you've read about that. My two partners at the time at Woodside, let's just say a little more seasoned than I am when it comes to the number of years we've been on the planet. And I didn't want them seeing the COVID patients. So we had a COVID unit of about 22 to 24 patients at any given time. I took that COVID unit, they took the rest of the nursing home. And so I would wake up early in the morning, I would do TV, I would go see the patients, run the company, do the rest of the stuff, and then end the day by following up on all the labs and everything I ordered on the patients. And in 2 weeks, I lost 5 patients. I can't remember in my career, and I've had some interesting weeks on trauma where I've lost patients, but in 2 weeks losing 5, that's a lot. And I don't forget them. I carry the names with me wherever I go. For these last 19 months, somebody asked me, why do you do what you do? I took an oath, and I lost 5 people that did not need to die. As I look at their cases, they did not need to die. But we had a virus that was spreading, and we were not doing what we needed to do to control its spread. All of a sudden, in the first time in my life, healthcare became political, and we weren't doing the right things, and I lost 5 people. Politics took front and center, especially with our non-pharmacologic interventions, i.e. masks. Remember, we really didn't have any pharmacologic interventions at that time. We had it late November when somebody finally got COVID and we got to use a drug off label, and then it got approved for everybody else to get. So till then, we really didn't have any kind of pre-hospital pharmacologic interventions at the time. Our staff were becoming infected, not able to come to work, mostly due to exposures outside of work. At work, that was the safest place they could be. But outside of work, it wasn't. And we were actually contemplating sending patients to a makeshift hospital in Milwaukee that was in a warehouse. That's how bad it was. I think it was a true breaking point for us in the state of Wisconsin in healthcare that will always be remembered. It definitely was truly my breaking point. The other thing I had to do, by the way, is as a practicing physician, most of you know that we have to take our boards. Well, guess when my recert was? November. And they wouldn't let me delay it. I took them and passed, just so you know. But I did so in protest. I was a grumpy person that week. You know, it was just a really hard time. It's very hard to ever explain. I think those of us that have worked throughout the entire pandemic in healthcare, at some point when this is over, we'll have to deal with that trauma. We haven't had the space and time to get through November of last year yet, but it was hard. It was India like this summer, where they saw death like no tomorrow, and we had never seen anything like this. So what do you have to do when you're in crisis? You speak up when you see wrong in the world, even though when many people don't want to hear it. We took out a 2-page, full-page ad in the Green Bay Press Gazette with all the physicians' names signing, begging our community to lock it down so we could get a breath, to wear a mask, and to just back down for a little bit, stay out of the bars. I live in Green Bay. That's like stop breathing or don't have any water, especially in November. You can imagine it. But hundreds of physicians did that. We doubled our media presence. We didn't hide. We took the hits. We took the threats. And I actually went on TV and I begged. to get through it because we were seeing things that nobody ever should see. Just the sheer amount of death and pain that we were seeing. We got on TV and we begged. So there's this shot that got announced and it went in front of the FDA. Things that, we've been following the studies and following the data. A lot of the pre-data was being out there, and we started prepping to give this vaccine in September, knowing that we probably wouldn't be able to give it until December. But the amount of planning that it takes to operationalize a mass vaccination of this kind is huge. And I was trying to explain it to our youngest, Cameron, who I hope comes to Stout because she's interested in fashion. Gonna put that plug in there for her to get accepted. She's 10, so she's working towards it. But I tried to explain what the vaccine meant to her, like how it works. If I can explain an mRNA vaccine to a 10-year-old, you would think the rest of the country would get it. Guess not. But explaining all the details to her, and she just looks at me and she goes, so it's like the beginning of the end. So that's my quote from Cam. So as soon as they were announced that they were under review, we started a plan on how to vaccinate our communities. And at that time, I wasn't a regent, but an interesting little happenstance in the story is, in March of 2020, right before the pandemic broke, University of Wisconsin-Green Bay was going to outsource their healthcare to a healthcare provider to increase the level of services, to bring a medical record on campus, et cetera. And they signed a contract with us, Prevea. So throughout this time, we had been advising UW-GB. We were doing the testing for UW-GB and eventually UW-Oshkosh. And everybody's like, well, where are we going to do this? There was football still going on, so you couldn't use Lambeau. Because that's everybody's default is to use Lambeau. And where are we going to do this? And so a quick text message to Chancellor Alexander. 2 minutes later, he calls me. I asked him. And so throughout this whole testing thing, every Monday I got a call from a very powerful man who I respected greatly. And when I was 18 years old, I got to ride an elevator with him once. And it was Tommy Thompson. And so my Monday calls were my Tommy calls, and he would check in on me every Monday and thank us for doing the testing at GB and Oshkosh. And when he found out that we wanted to open up the largest mass vaccination site in the state at that time at UW-GB, I've never seen lawyers work this fast. Actually, I've never seen a lawyer work fast ever. I'm a doctor, trust me, we can go hours in lawyer jokes. All right, guys? We had a contract done that night. We started pre-construction that weekend. Monday, we started actual construction, and we actually built an outside vestibule, a foyer. We redid parts. We had to bring in IT. As you can see here, I'll do a little show and tell just to kind of show you all that. We didn't want just pipe and drape. We wanted people to be safe. I said I wanted to do this fast, but do it right. So I've given a lot of shots in my career, and you know what some people do sometimes when you bring a needle next to them? They take a digger. So if you're just going to have like pipe and drape, like curtains there, guess what happens when one person takes a digger? Everybody takes a digger. So I wanted wood built. So that's pipe and drape on the outside, but they're actually wood built exam rooms, 36 of them built inside of a gym, check-in stations, and an observation area. So you can see the check-in stations up there. 4 days, all that construction, all the IT. I did a walkthrough. It started on Monday. I did my walkthrough on Thursday, gave the approval for opening on Friday. And then the governor made his first appearance externally since the pandemic started, with Tommy, of course. So I had two governors, and nobody wanted to listen to me that day, trust me, open up at that time, the first and largest vaccination site in the state. And then we repeated this over and over around the state. Jacobs Well in Eau Claire, one at UW-GB in Sheboygan, as well as Manitowoc and Marinette, and kept building these. And we gave the playbook away. Not only to give it away for the state, we did actually a national meeting, because this site, when rocking and rolling, can do about 200 shots an hour. And without drive up and making it safe, because everybody's like, well, let's just do a drive up. And I'm like, well, that works great in LA. Have you driven up to a place in January in Green Bay? It wasn't going to work. So we needed to build something. So do what's right, and the rewards will follow you. You know, we got a lot of criticism, believe it or not, for our vaccination strategy from other people in healthcare, because and I even got criticism from our own patients, because we opened up community vaccination sites. We did not open up Prevea vaccination sites. That oath that I talked about hangs in my wall. It doesn't say Prevea anywhere in it. So we opened up community vaccination sites so you didn't have to be our patient. And that got me a lot of criticism from our own people who thought they should be first in line, and from others that saying, hey, you're taking our patients. Oops. We built 5 of these, like I said, and ran at max capacity by the spring. Patients came to us from all over, including other healthcare systems, and tens of thousands of patients came to us for testing or vaccines in a 15-month time span. Almost 10% have now moved their healthcare to us. So sometimes when you do the right thing and you don't want to make money off of it, you wind up doing the right thing, and it's a good business decision as well. So important lessons. So now we're going to come to the point where I need to talk to you, but there are so many lessons I didn't talk about, so many interactions, so many things that happen. I would love to write a book one day. And unfortunately, I wanted to say, you can't make this bleep up was going to be my title. But I don't. I'm not a writer. I'm not a reader. But I can be honest with you, we have seen so many lows and so many really cool highs over the last 18 to 19 months. And what I've learned about myself is I would never have chosen another job, and I will never leave the organization or the city I live in unless I'm told to. You know, sometimes crisis will drive you away, and sometimes it'll galvanize you. And in this case, and it's been tough on my profession. I've had colleagues drop out, just tap out, time to retire, and others like myself, I couldn't see myself doing anything else. Leadership isn't easy, and no book would ever prepare me for this. And by the way, yeah, I'm one of those guys who hates leadership books. I really couldn't tell you who needs to be on the bus or not. It's not what I do. You know, it's the school of hard knocks. Sacrifice, we made a lot of them, but they're not sacrifices when you're doing something you care about. You will make those decisions. Some people are amazing, and I think about the phone calls of the friend with the pallet of masks, guy who has an extra UV machine sitting in a trailer. Some people are amazing. Some people suck. Ignore the sucky ones. I have a tendency to do so. And just when you think you know everything, trust me, you know nothing. So just keep learning. And I think I've learned so much in the last 19 months. And you know, being a physician, we call it the practice of medicine for a reason, because we're always learning. But learn something every day, challenge the norms. As a leader, which all of you will be one day, you need to learn faster than everybody else. And it's very important that you make learning part of your leadership path. So I have some dreams after this is over, and it will be over. We will learn to live with COVID. COVID won't purely go away anytime soon. Sorry to disappoint you. If you're looking for the magic bullet today, it goes from pandemic to endemic. People will continue to get sick. We will continue to get better therapies. In healthcare, we will learn to balance out the volumes, and we'll learn to manage our hospitals, and we'll learn to manage our communities. But so much of the death that we witnessed, so much of the death I witnessed was preventable. If we were a healthier world, less people would have died. This virus kills, but it kills people with medical issues faster. So we can be better as a society, and that's one of my biggest passions. And we need a world that understands science in a way that can be explained, especially in the world of social media. And I'm not one of those guys who, you know, is going to completely blame everything on Facebook, just 90% of it. But if that's going to be out there, those of us who are in science, those of us who are educators, those of us who are communicators, all need to get on the same page on how we're going to teach going forward, and understanding the principles. And understanding science and evidence is evolving. Every bit of research is evolving. And it's the question you ask that day. That's the plasticity of our brains. That's the movement that we desire of our world. We are going to need to generate a generation or two of people who understand sciences. I'm not one of those people that says everybody should go into STEM. I hope you're not misinterpreting that. We need to educate those people who don't go into science about science, because it drives so much of our lives, especially in a time of crisis. We need to be a beacon of hope and not a lightning rod of controversy. It's the only reason I give talks like this, and like I said, it's only my second one. It's not something that is easy to do, given what we've gone through, but we need to tell our story and turn back into that beacon of hope We need to save some people and not be that huge lightning rod. More hugs and less social media. So every time you want to go on Facebook, just go hug somebody. 6 feet apart, just air hug for right now, okay? Unless you're vaccinated. And thank you for all that you do. Over 70% vaccination rate on this campus. Congratulations, Chancellor, but more importantly, congratulations to all of you. That is awesome. Thank you for wearing your masks right now. Thank you for all the things that you've put up with and you still want to learn. You still want to come to school and learn. And I can't tell you how much that means to me as a leader, as a physician, as a regent, and as a dad. It is awesome to see what's happening on UW campuses. Coolest part of my time as a regent is visiting campuses, and I really enjoy it. So thank you, and now it's time for you to ping me. It's time for you, and trust me, we don't want to make this boring. Put anything else you want out there. We can talk about science, we can talk about anything.
If you have a question, please raise your hand and I'll bring the mic over to you. Thank you for.
I think it's on.
All right, so thank you for this presentation. This was great. How do you deal with so you mentioned 18 months, right? 18 months is a lot of time. And how do you deal with the burnout? I'm reading in the medical community, right? Lots of burnout, lots of people, trying to get out. How do you deal with that as a leader?
It's not easy. I have taken some time off. When we got vaccinated, we took a little time off. I think it's important to unplug. I don't do a good job of it. I'm not a very good role model for that, but I do encourage it. I think burnout is not working too hard. Burnout sometimes happens when you don't appreciate what you're doing or people don't appreciate you. I can work 24/7 if somebody says thank you. I think showing gratitude is amazing, and one of the best things I've learned is giving gratitude and being extremely transparent with my employees about my mental health and that I get help and that I want them to get help. Burnout's not about hours. It never has been. I mean, think about us as physicians. I'm one of those old school residents that could do 72 hours on call or whatever the crazy numbers they used to do. That's not burnout. So I think we have to create that mindset. I mean, granted, there's physical exhaustion. We need to break from that. There's mental exhaustion. But burnout's when you stop loving what you do. And I truly still love what I do because it's making a difference. And I do have a stack of thank you cards that sit behind me at work, and I'll grab them every so often when somebody shoots me a screenshot of what somebody said on social media, which I really beg people not to do anymore because I'm not on it and I don't want to know what people are saying. But I think it's really important when we're dealing with burnout is addressing it from a mental health perspective of understanding where their passion is, why that's happening, solve for the physical exhaustion, solve for the mental exhaustion, but then get to the issue of what's changed.
I worked in an assisted living home from November of 2020 until May of this year. And it was the first time I'd ever worked in healthcare. And I had 3 residents pass while I was working there due to COVID. And so I guess I'm just curious, like with you having your 5 that passed in that 2-week span, like how do you, I know all my residents and their families. I guess how do you cope with that and move forward?
You move forward for them, and that's how I've always lived. Still have their names, and that helps because I don't forget them. Loss is difficult in healthcare. We deal with it all the time. I'm dual trained in internal medicine and pediatrics, so I've lost babies. But I think losing people to COVID has been so difficult because of the way they die. And that's really hard to explain. And the emotions here are the emotions we feel every day. And that's normal, and we go on, but we talk through it, we talk to each other about it, and we get ourselves help, and I get help, because I love what I do. But when I talk about it being a different kind of death, I'm not talking about the medical aspect of it. You don't know what it's like to have to FaceTime a family member, and I actually knew this family member. It was actually one of my employees. I'm taking care of her dad. And she asked me, I asked her when I leave, I'm like, I'm going to go see your dad and it's not going well. What do you want me to do? And she's like, could you pray with him? So, okay, you're putting me on the spot because this is not something I'm very good at. And the only prayer I knew was the Lord's Prayer. So I FaceTimed the entire family and we did that. And I still remember that because that helps me get through my emotions because they were so appreciative. We're there to help in the hardest times. And it's okay to be emotional about that loss. It's actually better that you are. It'll make you a better worker in that environment and it'll make you a better healthcare person. But talk to somebody, get the right help, processes it, but don't make it stop what you're gonna do. But I go through the emotions every day. I walk by their rooms. What I didn't mention is in December, right before the vaccines were about to be administered, I got a call from my mom that my uncle passed away. I was expecting this call because he was very elderly and he had Alzheimer's and he was in India and I knew he was gonna pass away. So it was very sad for my father. It was his oldest brother and it was very tough. 15 minutes later, my mom calls me and says, your uncle passed away. And I'm very confused. No, it's my dad's baby brother from COVID in Florida passed away. So not only have I seen public loss, I've faced personal loss. He lived with us when I was a baby. And it's very tough when you see people fighting against you in this situation to deal with that death, but it's important that you do talk about it. And it's important that you turn that into motivation. I see one there.
Hey, Dr. Rai. So a couple of things you said stuck out to me. And when you were talking about the personal threats that your family received and how your wife is just very afraid and probably for very good reason, I noticed that you said, but it's okay. I don't know that it is. I don't think it's okay, but maybe it's worth it. Right.
Yeah.
And noticing how we talk to ourselves about things is really important as part of all of this. Right. And I noticed resiliency was in your header, and I love that term, but I think it's one that's misunderstood a lot. We think of resiliency and we think of strength, right? Which, yes, that's a piece of it. But if resiliency is bouncing back from something, we forget the part of what we're bouncing back from, right? And to the previous question, we're trying to respond to something, but resiliency is learned through pain. And it's learned in acknowledging the pain and responding to it and trying to find ways to not get crushed by something that wants to crush us. And so I guess I'm curious about your thoughts of that idea of resiliency and just how are you allowing yourself, you noted this, how are you allowing yourself to note the pain and now to publicly speak about it, which is never easy. What benefit are you finding that's added that maybe you didn't appreciate before the pandemic?
It's a great question. It's nice when someone in behavioral care picks apart your mind publicly. And I love you for that, you know that. I'll be honest with you, I think when I putting the slides together, like I said, I could have gone on for another 6 hours, was therapeutic in some ways. And therapy to me is not always somebody telling me how I'm going to be better. Therapy to me is a big portion to me personally is recognizing that, wow, that sucked. And you cried in front of 2,000 people. Those things, or the loss and dealing with that. I think the resiliency in me has come through dealing with all of that in safe spaces, including mental health rooms, and then moving forward, trying to learn something from each episode. That's been probably the biggest part for me. And you're right, resiliency is not me being the tough guy. It's not me being the ego. It's not being the guy who can, everybody thinks the best leader in the room is who can bark orders across the room. Those are sometimes the worst, just so you know. I think I learned a lot about myself, about leadership, about people. And part of that was that resilience process of just processing every single thing. And yeah, the threats, I'm okay with it because I've processed that and I realized that, the majority of that is just words. And in some ways, I feel sorry for those people because that's the only way they can express their anger. So I've kind of talked my way through that with a variety of people like you and helping me in different situations. I think I saw one back here.
Thank you. So I find your quote kind of touching about healthcare needs to be a beacon of hope, not a lightning rod of controversy. Just thought I'd bring up a little personal experience on one of my sides of the family. It really is kind of a controversial thing. So like every time we say go and visit them or whatever, we'll bring up like the vaccine and just other things. I guess just like in a nutshell, like what advice do you maybe have about like how we just kind of like interact with them?
It's hard. You know, my wife's family has an anti-vaxxer or two in there. And I think anti-vax is actually a really bad term, so I should stop using it. There are people who have been misguided, misinformed around the science behind the vaccine, unfortunately, and that opinion is coming out in the forefront, usually promoted by people that want to disrupt our society, if you actually look back at all the research. Having discussions with people that don't always see eye to eye with you is one of the probably the biggest learnings you can graduate with. Whether it's a vaccine, who to vote for, you know, what should we do with our money, the environment, there's always going to be controversy. There's ways to approach that in a family environment, and I'm not always saying ignore it, but when it comes to safety, it's also letting people know how you feel about your own health is how I usually start. So, family wants to have a get together, 50% not vaccinated, 50% vaccinated, I'm not going to go. And I'm just going to educate them on why. And it's for my own safety. And unfortunately, not everybody's going to like you for that. If I gave speeches and talked on TV expecting everybody to like me every day, it wouldn't end well. But I think it's important that you always go with fact, you always listen. Nothing is an absolute. Nothing I presented today, and I could give you a 2-hour lecture on mRNA if you'd like. You'll all fall asleep pretty quickly. But nothing's absolute. Even in what we're talking about the vaccines and the most recent literature on boosters, if you asked me the question 9 months ago, I'd have given you a different answer than I give you today. And if you can actually have a conversation admitting the fact that you don't know all the facts, usually the conversation goes better. To listen, not to change your opinion, but to listen and to educate. And no, you're not going to always win that argument. And it does divide people. I mean, we live in a very, very divided world right now. And I never thought science and politics would merge like this outside of nuclear weapons. You know, really, when's the last time you really had, or environmental debates, but now it's around health. And it's very difficult for those of us in health to see that. And I hope at some point we'll evolve. We'll have to. See one there, one there. There was one behind you. Yeah.
So going back to what you said about booster shots, like what is your stance on them? Like, should we get them if they become available, or?
Yeah. So it's important to understand that. So she asked me about booster shots. I'm not sure everybody could hear that because I don't think the mic was on. You know what my opinions are on them. So I'm boosted. So there you go. First, you know, I can, you know, say that I got it the first day it was available because I can. It's important to understand that if you don't get it, you still have a really good level of immunity. So being vaccinated is very important. When we talked about waning immunity, it really was in the face of a virus that was acting very differently than the virus that this initial vaccine was tested against, so the Delta variant. Delta is kind of a game changer, not for how sick it makes you, but just its level of spread. So as we're looking at how do we mitigate spread more, and about 25% of breakthrough infections due to waning immunity, in certain populations, it makes a ton of sense. Those who are always exposed, like those of us in healthcare, students, congregate settings, teachers, definitely should boost it. It doesn't mean that the vaccine doesn't work. I would love for all of you to go home and ask mom and dad for your vaccine card growing up. If you have a mom like mine or a wife like mine, they don't throw anything away. They probably still have your birth certificate, you know, pictures of your feet. They're going to have your vaccine card, pardon me. Every single one of them but one will have 2 to 3 to 4 doses on it. Those are all boosters. That's naturally how we develop immunity from a vaccine. So the fact that we're doing 3 is absolutely not shocking at all. It's normal science. The safety and efficacy has been shown of it. So I am for it. Now, do I think everybody has to have one? No, because we have a good level of immunity and a little bit of control. But when we talk about risk and reward, very low risk, very high reward in that boost. Hopefully I answered your question. I think there's one in the back of the room I think I saw.
This from the live stream. So you mentioned the likely wave of processing the trauma for professionals. How do you expect the medical field to prepare to address the trauma?
You know, I think that's a great question. I had an awesome conversation about that a little today. We are very, just so you all know, I had some awesome meetings at Stout with your behavioral care department, and then they had to end because we got distracted for 19 months. And back then, if we went there, we talked about how undersupplied our workforce was in behavioral healthcare, especially counseling. And now there's a huge magnifying glass on it. We are way undersupplied. So obviously, the best way healthcare can address this is training more people, but also training everybody in mental health first aid to recognize when somebody's hurting, to help them get the right help. So when we work with companies and schools, it's really talking through that as well. But a lot about addressing trauma is, as we talked about today, recognizing the trauma. And a lot of healthcare still needs to recognize all the trauma we've gone through, and it's really hard to do because we're still traumatized. This morning in Green Bay, our hospital censuses are through the roof. They're approaching November of 2020 numbers right now. So we haven't taken that pause button to really address our trauma yet. So globally, healthcare needs to fix itself. And find help, and then hire that help for everybody else. So it's going to be a multi-step process. The world won't get over 700,000 deaths just in this country overnight. And we have to recognize that and understand this is a long haul, and we have to develop the tools and the people going forward. We shouldn't be graduating 16 people a year out of the counseling program. It should be 55. I just gave her some chest pain around the corner. But then we, as regents and as a UW system and as a governor and as a legislature, need to address that. We need to put the money where it's needed right now. We need just as much money and time in mental health as we did in the vaccine development. Yes, sir.
What made you want to be more than a doctor and actually become a CEO and a president?
That's an awesome question. So the question was, because there was no mic, what made me want to actually become a CEO and outside of just being a regular doctor? So when you're in a multi-specialty group like I am, and it's governed by physicians, if you go to the bathroom at the wrong time, you get volunteered for the wrong committee. And then next thing you know, you're the president and CEO of the company. I never wanted to do this. In all honesty, I never wanted to do this. And then I got put into more and more leadership roles, and my practice life was, I loved what I do. And I still love what I do. I love the intensive care unit. I loved the hospital floors, but everything I saw, not everything, 90% of what I dealt with was a failure of the healthcare system. So every patient I lost, if I had gotten that patient 3 months before, 6 months before, 6 years before, their outcome would have been different. So after years of losing patients, taking a knee, telling a family that their 45-year-old dad's not coming home because of a heart attack, you know, X, Y, or Z person has cancer, and having to break that news, I was still very clinically good at it, but I was getting to a level where I was frustrated. I wasn't doing enough with my education at that point, in my mind. In this role, by taking this role, still practicing, but having a much broader voice and being able to guide a system around health instead of sickness, and that was my passion. That would have been my talk pre-COVID, by the way, that really is what led me into leadership. I believe that healthcare leadership has way too many MBAs and not enough MDs. And no offense to anybody watching online, but I really do mean it. I think we have way too many business leaders leading healthcare and nobody who's actually taken the oath and that still has that commitment to patients. And that's what drove me into leadership. And it has been my passion. And I think that passion came out through COVID and the investments we made. I didn't make MBA-based decisions. I made MD-based decisions. And granted, we did okay financially, but our decisions were never based on the money at that point.
Thank you for your awesome presentation, kind, compassionate presentation. I was really impressed with it. I have a question. You talked a little bit about how COVID's upended healthcare, but it's also upended a lot of different things. Our educational institutions, day-to-day work balance, all that. So I'm kind of thinking of it from an employee perspective. What have you learned regarding work-life balance? And I know it was kind of interesting that you talked about someone else brought up burnout, but you kind of mentioned working hard and all this, but I'm really concerned about work-life balance for employees and students and things, and as they become employees, because I know there's been a fundamental change I see out there, not just from the university, but even in the private sector on this. So I'm kind of curious what you think the long terms are going to be here and how important is that work-life balance to a healthy society?
So, and this is where my wife is going to giggle because like he's the worst example ever. I honestly preach it every day to our staff. I actually address the company every Monday, and I usually end with take care of yourself and try to create systems of work-life balance. Not always the best financial decisions, but the right thing to do to make sure that people are getting out and getting the time they need. I do believe that COVID has allowed us as industries across the world to reassess what we need to produce and what is needed of us, and more importantly, what's not needed of us. We've seen that through certain companies doing very well in virtual environments and certain companies failing in virtual environments. I think there's going to have to be some really good research out there, not leadership books, I hate those, but really good research on what works best in that model. I mean, we've had kind of this spontaneous lab, for a lack of better words, for 19 months with lots of data on how companies responded and what they're going to do. And now we have a workforce challenge across every industry, right? I mean, we have 700,000 people out of the workforce because they're not alive anymore. Say 30% of them were out of the workforce anyway because they're over the age of 65. But there's a lot of people that are no longer in the workforce who's not alive. We have to adapt to it. We paused training for 2 years, so there's a backload of what we can produce in new workers. And we really do have to do some strong analysis on what is best. And I think work-life balance will come into that discussion. I don't have an answer, but I do hope that economists and mental health experts and those that design processes look at all the data that we have now in the last 19 months and the benchmarks that were set prior and try to see what is best and guide us going forward. I can tell you in healthcare, we are off kilter because we're short-staffed and we don't get to shut our doors. So if Starbucks has sorry, I don't mean to pick on Starbucks, but I do, because about 50% of the time they're closed down the road from me because of COVID or workforce stoppages. It's kind of like this funny signs on the door. Monday night, my daughters were dying for Buffalo Wild Wings, God help us. But they had special treat day, so we said yes, and they were closed. Monday Night Football. Who's ever heard of BW3s closing on Monday Night Football? But in healthcare, I don't get to put up a little white sheet of paper and says we're closed. So we have significant issues. We are way off kilter when it comes to the balance right now. So we are trying to fix that by hiring and by staffing up and creating different ways that people can work. I think the rest of the industry is going to have to figure that out. I think we have an awesome opportunity for those that research to do some good data on this, on what the right solution is. I don't have it.
Okay, we have time for one last question if someone has it.
Right there.
Try not to be too convoluted, I suppose, but I think one of the most touching parts of what you talked about today was your willingness to be vulnerable, to cry in front of others, to risk not knowing, to risk being wounded, to show your wounds. You talked about in time of crises, the dissolution of ego, the need to let go of competition, right? Which I think is a wonderful thing, and we need that in crises. Yet we have large swaths of population who live in crises all the time, whether it's through scarcity, underserved populations who don't have access, that require the same level of empathy, that require the same level of vulnerability for people to show their wounds, to risk being wounded. How do you think, I'm going to ask two questions and maybe you can answer. What are barriers to that vulnerability in our day-to-day life to not necessarily recognize those other crises that are happening? Or what are ways in which we could better embody that empathy, better embody that vulnerability to see others? Yeah, I suppose that's it.
It's a great question because we only talk about one crisis in the last 19 months. We ignore a crisis that I put a lot of time and financial effort into, which is the crisis of disparity in healthcare, which COVID-19 showed a magnifying glass on, but all of us in healthcare know that systemic racism has been part of our thread of healthcare since the day I took the oath. And whether it's race or sexuality discrimination, I have witnessed it, seen it, and been taught it throughout. So when it comes to the vulnerabilities, to me, it is admitting the problem, which I actually did on television in a pretty much white town, which was interesting, let me tell you. And I think, so that's an example of where I think we need a lot more discussion. And vulnerability sometimes to me is admitting the problem. It's kind of like AA. Hi, I'm an alcoholic, hi, I'm a racist. Hi, I'm an anti-scientist, whatever it may be. It's people getting up there and recognizing they have an issue before we can fix it. So I'm hoping that as we emerge out of the pandemic, that we are much better about those discussions. We are much clearer about admitting a problem and using terms that make people really uncomfortable. Whether it's in the AODA world, whether it's in the diversity world, we have systemic issues as a society that COVID-19 has brought right up to the foaming top. And we can't waste this crisis. We can't lose hundreds of thousands of people and not want to fix our society. So I told you about my dreams, right? I want to see a healthier society. I also want to see us accept all of our other issues too and work on them. Now, as an organization, we are full in on that. Actually, I can send you a link. We're actually having a statewide conference on the racial inequities that were shown through COVID-19 and how we can tackle them going forward. So I do believe that the vulnerable questions, the emotions, it is getting out there and having very frank conversations about that, sometimes without fear of our own emotions coming out.
Well, on behalf of the university, Dr. Rai, thank you for being with us today. And please join me in thanking Dr. Rai for his presentation today. Thank you.
We have a little something for you.
Oh, thank you.
This is something for your mother to hang up next